In 2011, the UNAIDS Program Coordinating Board NGO Delegation conducted a series of 27 focus groups involving more than 240 participants from every region of the world. Participants agreed that criminalization, stigma, discrimination, repressive laws and policies directed at vulnerable populations undermine HIV/AIDS responses by discouraging access to HIV-related services and discouraging HIV service utilization.
No gay man in Jamaica trusts the public health sector. In order to get treatment, whenever I go to a health center, I have to lie. So I have to be hiding from my family, I have to be hiding from society in a whole as to who I am truly. I can't go to the police and report a crime against me as a gay person. I have to lie about it, and that is due to the law.
Somebody who lives with a drug addiction, just having a clean needle means that the police are all over him. He can't think about getting access to HIV services or HIV prevention. When a sex worker is arrested just for having a condom in her possession, this completely undermines her access to public health services as well and to her own protection.
Sex workers are fearful to report and have no access to justice. Even sex workers, when do, their complaints are ignored.
The epidemic has a disproportionate impact on women. They can't negotiate whether their partners use a condom. When they get infected, it's often hard for them to access an HIV test because they're afraid of the consequences. They're afraid they'll be beaten, they're afraid they'll be abandoned, they'll be afraid that their partners won't take care of them.
It happened to me in 1997. I mean, I'd gone to a hospital for a service, a reproductive health service, and I was told that I would access the service only if I consent to sterilization.
You have things like corrective rape, which is happening for lesbians in South Africa.
All sorts of marginalized groups are having their rights violated in healthcare settings. This is deterring people from coming to healthcare settings. And how can you scale up to universal access if healthcare settings are not indeed a place of care and support, but are actually places of rights abuses?
The medical practitioner is not supposed to disclose the test result to your employer without informing you, but they go ahead and do it anyway. And then the employer will terminate your employment on the basis of your HIV status, and they will never tell you it's about HIV. People who want to get married, the religious leaders say, we cannot marry you until you come with a HIV test result. But go get tested, and then we will decide whether to marry you or not based on your status. That's discrimination.
People who are seeking asylum, they're fearful of going for a test, of having to access services because they're scared of what the authorities will do to them.
If you look at prisons, if as many of our governments have decided to do, you say, well, these people are just criminals, we're not going to give them access to condoms because that's encouraging homosexuality. At the end of the day, you're exposing people to HIV.
Many countries pass laws criminalizing HIV transmission.
An Albuquerque man used a deadly weapon trying to batter a police officer. The weapon, his spit.
When you start criminalizing HIV transmission, who is going to come forward to test? I will not. If I'm going to be prosecuted because I have tested and known my status and I want to take responsibility, I would rather not know. And that is the attitude most of the people take. So criminalization undermines public health efforts. There is also now evidence that treatment acts as prevention. When people don't get to know their status, how are you going to treat them? And then we will not achieve the goals of actually then preventing HIV transmission.
Based on its findings, the UNAIDS PCB NGO Delegation recommends that UNAIDS support anti-stigma and HIV education campaigns in an effort to increase and enforce protective laws, oppose and repeal laws that criminalize HIV non-disclosure, exposure or transmission, homosexuality, gender variance, sex work, and drug use, foster protective laws and knowledge of protective laws, and respect for human rights within the justice system, and support and promote programs that educate individuals about their rights and promote access to justice.